If you have acne, you've probably heard some pretty random advice from some pretty random people. I'm not exaggerating when I say I've heard hundreds of opinions on what works for acne. Spoiler alert, most of them don't. So if you're confused, frustrated, or just tired of listening to worthless advice, this video is for you. But first, make sure you hit that like and subscribe button below. This is my 5-step, no-nonsense, comprehensive algorithm for treating acne. Following this guide works for 99% of people, if they actually do it. I'm Adam Aldahan, board-certified dermatologist, and I've spent a bajillion hours researching and simplifying complicated topics, so you don't have to. Acne treatment is anything but straightforward. It can be extremely convoluted, but that's mainly because A, there are different types of acne: comedonal, inflammatory, hormonal, nodulocystic, steroid-induced, and B, there are other patient-specific factors we have to consider when treating their acne. Like, do they have sensitive skin, oily skin, combination skin? What does that even mean? Are they pregnant? Do they have dark spots? And what about scarring? There's more. Are they just hitting puberty? Or maybe they're adults, but they've never had acne as a child. Do they drink alcohol? That can change our treatment options. And a big one, are they using comedogenic skincare products such as coconut oil? What does comedogenic mean? Simply put, comedogenic means clogging the pores. Things that get into the pores, block the pores, and make it harder for things that are supposed to get out to do so. If you're interested in learning more about coconut oil, check out some of my other videos here, where I dive into some other effects it has on the skin. Number C, people just fill the internet with total baloney and utter nonsense. And no one knows it's real or fake anymore. To everyone who puts false information on the internet just to get views and likes, unacceptable. Before we get into treatment options, I'm going to quickly go over the main types of acne so we can know what we're dealing with. If you want to skip ahead to treatment, be my guest, but don't overstay your welcome. Some acne is comedonal, meaning it leads to whiteheads and blackheads. That's pretty much it. This is a mild form of acne, really without much inflammation. P.S. Whiteheads and blackheads are actually the same thing, just at a different point in their evolution. Whiteheads are what we call closed comedones, which are clogged pores that fill up with oil and dead skin. Once they break through the surface, they're exposed to oxygen, and it's only after the oil is oxidized that they turn black, hence blackheads. Some people get a lot of blackheads and no whiteheads. Some people get a lot of whiteheads and not really any blackheads. But if a whitehead turns to a blackhead, how come there are no grayheads? Isn't that kind of odd? How many shades of gray are there again? After comedonal acne is inflammatory acne, which forms pustules or inflamed pimples. This is the type that most people associate with classic acne. Next, we have hormonal acne, which, as the name implies, is triggered mainly by hormones. This often has predictable breakouts around menstrual cycles, and it classically involves the chin and jawline. Finally, we have nodulocystic acne. This one's tough. These patients tend to get deep, painful nodules under the skin that can last weeks and have a higher propensity to develop scarring. So acne treatment is not one size fits all. There are levels to everything, including acne. Let's start with level 1, over-the-counter stuff. Before you even think about treating your acne, you have to remember one thing. Do not, and I mean do not, apply anything comedogenic to your face, and that includes coconut oil. Did I already mention that? Other examples include marula oil, avocado oil, and some waxes like aniline.
Don't do it. Don't do it.
Don't do it. If you're applying comedogenic garbage to your face, you can kiss your acne treatment goodbye. And you can kiss your acne hello. I'll leave links in the description for all available products that I talk about. Some of them come from my medical grade skincare line, Anovo Skin. Be sure to check those out first. Now please keep in mind that I only recommend Anovo Skin products to people who want the best skin possible. Okay, let's get into it. A general starting point tends to include a morning face wash and a nighttime retinoid cream. Let's talk face wash. We have options to reduce or prevent mild acne breakouts. Salicylic acid is a beta-hydroxy acid that works really well at clearing oil from the pores. Sulfur or sulfacetamide can remove layers of dead skin so they don't end up clogging the pores either. Glycolic acid removes oil and layers of dead skin. Any of these face washes are a good starting point for most. I usually recommend washing your face in the morning and after a long day if you're sweating, oily, or if you had a long day wearing makeup. Over-the-counter nighttime creams include retinoids like retinol or adapalene. While retinoids can be drying, these two are some of the mildest forms available, so they don't tend to cause much irritation. If you have really sensitive skin, maybe you'd prefer something like hydroxyphenolactone retinoid. This one's really gentle, but still effective. Great for anyone who gets irritated by just about anything. If this sounds like you, maybe check out my Retin Ease product. Really high quality stuff. Topical retinoids are best used at night, and a little goes a long way. As long as you have a thin film on the affected area, that's enough. Now let's bump it up to level 2, prescription strength topicals. Now unless you're pregnant, you definitely want to keep a retinoid on board at all times. That's a bare minimum. You could either bump up your adapalene strength from 0.1, which is found over the counter, to 0.3%, which requires a prescription, or you can skip ahead to everyone's go-to, which is tretinoin. This comes in several concentrations. I usually start pretty light at the 0.025% concentration and ramp up every few months as needed and as tolerated. If you max out tretinoin and you're tolerating okay, but maybe still have some breakthroughs, then I consider bumping up to something like tazarotene. Or if tretinoin is too irritating and you want to be really fancy and maybe have a little expendable income, you can try the one that no one's talking about, which is trifarotene. This works just about as well as tretinoin, but with much less irritation. It is a little pricey, but what's money if not just a vice to keep us running in circles like a hamster on a wheel, like a dog chasing its tail, a donkey chasing the carrot at the end of a stick. In addition to the retinol of your choice, you can add an antibacterial face wash like this one. Benzoyl peroxide is an oxidizer that cleans out dirt and bacteria on our skin. Gold standard when used alongside retinoids, but not at the same time. Don't mix benzoyl peroxide and retinoids directly, because benzoyl peroxide doesn't know good from bad, so it'll eat up your retinoid just like it does bacteria. So general best practices are to use benzoyl peroxide in the morning and your retinoid cream at night. If you really need to tackle the inflammation, you can also add something like topical clindamycin. This is both antibacterial and anti-inflammatory, which does a really good job at calming down really inflamed pimples. Not always needed, but some people like it. Alright, level 3. Just say no to antibiotics. I don't use antibiotics to treat acne. There, I said it. Come get me.
But Adam, why don't you follow the 2024 American Academy of Dermatology guidelines for treating moderate to severe acne?
Let's zoom in, shall we? See how it says, limit systemic antibiotic use when possible? There's a method to my madness. Before I move on, here's why I don't use antibiotics to treat acne. Antibiotics lead to A. Temporary relief. They only work when you use them, and you can't use them forever. You just can't. B. They have loads of side effects. Doxycycline causes GI pain, diarrhea, photosensitivity, meaning you can't go in the sun. Minocycline can cause drug-induced lupus, and long-term use can permanently stain your skin blue. Nobody wants that. Bactrim can. Don't even get me started with Bactrim. Fix drug eruption, Stevens-Johnson syndrome, just to name a few. No thanks. I've seen one too many people with life-threatening skin peeling from Bactrim use to even think about prescribing it for acne. And before any older dermatologists come to get me, yes, I know it's a rare side effect, but if you tell me I have a 1 in 1,500 chance of having a life-threatening side effect just to treat my acne, I'm gonna pass, thank you. And C, antibiotics lead to antibacterial resistance. I'm a big proponent of antibacterial stewardship, meaning we should think about the long-term effects of antibiotic use before we just toss the pharmacy a prescription. We shouldn't use antibiotics unless they're absolutely necessary, because over time, bacteria become resistant to antibiotics. This can happen on an individual level and on a global or population level. If you ever get a serious infection in the future, you don't want to find out that your bacteria are resistant to conventional antibiotics, and now we have to pull out the big guns with lots of extra side effects. Okay, I think I've made my point. Moving on to level 4, Spironolactone. Asterisk, best used for hormonal acne. Hormonal acne predominantly affects the chin and jawline and usually has cyclical and predictable outbreaks. Spironolactone is super effective if you have the right diagnosis for it. It can lower your blood pressure, and sometimes it can cause headaches or lightheadedness, but at a low dose sufficient to treat acne, it's generally well tolerated. Spironolactone is not a birth control. It doesn't directly affect your circulating hormones. It just blocks those hormones from hitting the receptors on our skin that are activated to produce acne. Even though this is not a birth control, it's not a good option in pregnancy. If you happen to get pregnant while taking this medication, not a big deal, just stop it, but it can have some hormonal effects on the baby starting around the second trimester. And finally, level 5, Isotretinoin. Brand names, Accutane, Roaccutane, Claravis. This is a cousin to tretinoin, but comes in a pill form. Isotretinoin is really a topic of its own, but here are the main points. Yes, it's a pill. Yes, it has lots of side effects and requires lab monitoring. You can't even think about getting pregnant while taking this medication. We test you every month just to make sure. It's more effective than any of the previously mentioned treatments for just about every type of acne, but we essentially reserve this for nodulous cystic or deep, painful, and scarring acne. It's usually a permanent solution. After completion of a treatment course, it's really rare for your acne to come back to any significant degree, and it does not affect your mood. Yes, I said it. Now, before you hunt me down about some personal anecdote about how Accutane affected your mood or someone's mood that you know, let's go over the evidence. This whole mood-changing side effect has largely been refuted in recent studies. There's simply no evidence directly linking isotretinoin to worsening mood. This study showed that patients on isotretinoin had, quote, overall improvement in psychological well-being, even in patients who had known stable mental illness, end quote. Now, if I have a patient with mental illness that's not stable, there's no way I'm prescribing isotretinoin. But it's not because of the mood or psychological side effects of the drug. I would avoid it because you really need to have a stable state of mind to be able to follow the routine and do everything necessary to comply with the regulations of isotretinoin. You have to understand what you can and can't do while you're taking it. People with acne are often teenagers who have a lot of emotions, especially when they have severe acne. They already have naturally high rates of mood swings and depression. So it's definitely reported that patients who already have mood swings may continue to have mood swings while taking isotretinoin. It doesn't mean the medication is causing their mood swings. Point point blank. If a patient has both acne and depression, and the acne is possibly contributing to their depression, successful treatment of their acne has been shown to improve their depression. And yes, this has been studied too. Alright, that's acne treatment in a nutshell. Don't overcomplicate it like I just did. Hope you enjoyed your coffee break.